Welcome to the RD Squeeze. I'm Nikki.
And I'm Emily.
And we're two dietitian besties here to squeeze out the misinformation around health and nutrition.
All right. Hello, everybody. Welcome to the RD Squeeze with myself and Emily. Very excited to be here. And we have a really great topic today. We are talking about preparing for perimenopause. And we have an awesome guest with us today. I am going to introduce Dr. Jessica Bachman. So she is a PhD RD and is the Director of Operations at Stronger You Nutrition. And she has her PhD in nutrition with a concentration in exercise science and is a registered dietitian nutritionist, as I mentioned. So prior to working with Stronger You, she was a university professor where she enjoyed teaching as well as conducting and publishing research primarily on eating behavior and weight loss. She is primarily a weightlifter that pretends to be a runner and loves to climb big mountains, which is more than I can say for sure. She is a mother of two and is particularly passionate about women's health and helping women feel good in their bodies through big transition periods, such as adolescence, pregnancy, and postpartum, and menopause. As an avid exerciser and lover of learning, she is also interested in fueling to optimize body composition and exercise performance, and is currently working on her personal training certificate. And we are very excited because I was stalking her social media and she was doing all this amazing stuff about perimenopause. And I was like, that's the guest that we want about perimenopause. So welcome, Jess Bachman. Thanks for being with us.
Thank you. Thanks, ladies, for having me. I'm so excited. These are some faces I've known for quite a while now. So it's great to be here.
Yeah. So I know I met you through NEPAN, and I think that's how Emily, did you meet?
No, I had Dr. Bachman as my professor in my graduate studies. So she was my professor originally. And then, and then I was a grad assistant for her. And actually, I think you encouraged me to apply for that. And then, I followed her in the presidency of NEPAN. So yes, we have 3 previous presidents here of NEPAN.
That's funny because then as we were kind of transitioning, that's how Jess and I met. And I actually, before we got on this, but I'm going to mention it here, Jess is the reason why I got into improv, believe it or not. She's the person I followed to a jam one day. I talk about this all the time when people are like, how'd you get into improv? I was like, I was bored and I met I had a registered dietitian friend, and that's where we got involved. So yeah.
And I got involved with improv is that I was telling a friend this over COVID. I was like, what would be absolutely terrifying to me is improv. Like that's something that I'm just so amazed that people can do this. But I love growing and I feel like learning how to be better at improv would be better. I do a lot of public speaking. That would help me a lot. And so lo and behold, this woman, Diana, moved to the Clark Summit Scranton area and put on a workshop. About a month later, my friend signed me up for this workshop. And so I started doing improv and I was absolutely terrified of doing it. But it was such a great experience. And I do think it's made me a better communicator. It's made me more confident on the stage when I'm presenting now. It's really kind of changed my communication style, even though I'm not currently actively doing it anymore. But it really has brought a lot into my life from a professional standpoint too. It's been wonderful.
Yeah. I couldn't agree more. I feel like I've used all the skills I learned in that, throughout my everyday life too. But you've had like such an amazing career journey. Jess, do you want to tell us like how you even got into nutrition and then like your whole journey? We'd love to hear it.
Sure. I'll do the a shortened version, but I will go back to the beginning, right? It's started with, I think, and a lot of people I've talked about in the nutrition field started just being, I was an athlete growing up, but really was thinking a lot about body composition and wanting to be lean and wanting to be skinny as a young child, right? Even a young adolescent. That was really the time period where everyone was dieting, everyone was super thin. Like that was a thing. And so I got interested in nutrition, probably not from the healthiest place. But what I learned was that it was such a cool science. And I went to Penn State, thought I wanted to be in engineering program. I got into engineering program, took my first calculus class, kind of looked around the classroom. No one really looked like me in there. Wasn't really my vibe. I hated that class. And so I switched into nutrition after having my first nutrition class. I just didn't even know it could be a career. I was like, I like this thing. I like eating healthy. I like how it makes me feel. But really fell in love with it from there. So I went to Penn State for my undergrad, randomly applied to school down in Tennessee. So I went to the University of Tennessee. I just wanted to go somewhere different. And they had a dual master's degree program down there along with getting the RD. And my first semester there, I met a professor that really saw something in me and said, "Hey, I really think you should consider doing your PhD. I see this as a passion of yours. You're really good academically." He got me involved with his research. Ultimately ended up working with a different professor for my PhD, but got for the American Heart Association, I got funding for my PhD program. Things kind of fell in place for me. And so it does feel like something that had been a calling for me a little bit for my entire life. And my interests in nutrition have changed dramatically over time, but it's been such a beautiful evolution of this thing that started off from pretty unhealthy spot to really thinking about fueling and providing this career for me. And so right from my PhD, I got involved with research, was an academic position, went straight from there to working at Merritt University, was teaching, doing research there. Truly loved teaching. I loved working with students. Emily was one of the best students. I'm not just saying that because she's here. She's fabulous in class. I actually think I was on your thesis committee too. Like you were
I
just
think you
fabulous
were, yeah.
student. You were so easy to mentor, and there were so many wonderful students. Worked there for a few years, went to the University of Scranton as a professor there, got promoted, was doing the whole tenure track, but just something was just missing for me in my life. It was kind of like too predictable. It was you follow these steps, and I was looking for something else. Came across this company called Stronger You. A former student of mine was working for them. She was coaching online, and online coaching was new then. This is 8 years ago. It was this brand new thing. People were getting really interested in it. I joined as a member myself first because after having 2 kids, my lifestyle had really changed. I didn't feel healthy anymore. I kind of felt in a spot where I was a lack of confidence again, really self-conscious about my body again. I kind of lost all the good, healthy feeling I had after having 2 kids, and felt so amazing working with a coach, having a plan, got my confidence back, but in control of my nutrition. Ultimately, that company started to really explode. And so I told them, I wrote my job description, said, "Hey, you need to hire someone to train your coaches, organize some of your operations." And I've now been with Stronger You for 7 or 8 years now at this point. We've been acquired multiple times. We're now a part of Purpose Brands, which is a large company, who's the parent company of Orange Theory Fitness, Anytime Fitness, the Bar Method, Basecamp Fitness. And so we are the nutrition providers and resource across all those brands now. And so even my role within that company has really evolved over time. Just one last note about that. I know it's kind of longer than I wanted to talk about, but I think what's pretty cool about the position I'm in right now is that it's very different than what other RDs typically do. I never really went the clinical route. That just wasn't something that drew me in. It's a great opportunity for some people. For me, it wasn't the thing. And I think it's great. The things I learn as an RD and what I'm able to provide from all of the science I have behind me, the nutrition knowledge I have, but also RDs have the personality characteristic where we are really organized. We're really good leaders, and we have all these other tools that RDs don't always use so much. And in my role, I get to lead gigantic teams. I get to be a part of strategic planning. I'm getting to do things that I do think came a lot from the training I got as an RD. I'm just using kind of it in a different way than maybe you're taught in school. So I think it's been a pretty cool career path. And definitely has some benefits compared to some of the other jobs, and some things I miss too, though.
Well, and I think to your point, first off, like amazing background. I was always like wanting to know, how can I be Dr. Jess Bachman and follow her footsteps? And so in some ways I did, because you brought me to the U as well, and I was a professor there for a little while. And I just like the fact that you've kind of created this role in such a, I'll kind of use the word corporate ladder, in the sense of bringing dietitians to the table in these ways that dietitians haven't before. So can you like maybe elaborate on, you shared that you gave like a position description. Like, how did the company feel when they gave it to you? Was there a lot of back and forth, or was it like, yeah, let's do this?
There wasn't a lot of back and forth. I think it was a small startup, and it's just I think in every way that my career has kind of expanded, it's like if you notice a need and you just kind of start working in that space, and they're just like, "Hey, look, I'm really good at this. Like, you should hire me." And asking for what you need and want as a woman, that's sometimes hard for us to do. And I found success in that. I've gotten into the right rooms, I've been in the right conversations, and I presented myself in a way that sometimes, even if I didn't quite believe it, I showed up in the role I wanted to be. I showed up with the confidence that I am meant to be there. I should be doing this. And so I knew they needed me. Like they needed someone to organize their operations. They needed more structure. And I knew I could be the person to do that. So there really wasn't too much back and forth. And that's as my, that was a smaller role that I was doing just education at that point. Now I'm the director of operations and I'm across all these brands. And it's just really advocating for myself and my team and really believing that I have these skills to offer. That's really going to help. I'm like, I'm going to help your members. You need me because nutrition is going to help your members. Like you have to position it. So the way you show up and the way you present yourself, I think is really important for the overall, for you professionally.
And I do think that's a hard thing that our profession might struggle with. And I'm not going to lie, I do too. Like imposter syndrome just brings us in. And, we have all these different, I mean, you work with the companies who have the health coaches, who have personal trainers. So can you maybe allude to, before we get into our big topic today,
Yeah.
just any like, how had it been a struggle, I guess, at all to get your message across to some of these other professions that are not dietitians, and where like the
Mm.
balance was and where kind of like that scope of practice stays at?
Yeah, it's really, I wouldn't say it's a struggle at all. I think that most of the companies that we worked for, they ask that question right away. They're like, what can I say? What can I say? And there's so many like nutrition coaches, health coaches. I am a fan of. I mean, you guys know I work with them. I train health coaches, nutrition. We have RDs also, and the RDs have their space. But there's a lot of great things you can do a lot, and most people can get most of the way to their health goals. Let's be honest here, with just following general healthy nutrition. If people create a plan and on a daily, regular basis, they're eating out of a protein, they're eating fruits and vegetables, without even having to look at their blood work or doing anything like that, you can get someone to really make a huge change in their life. And that is what personal trainers are trained on. They're allowed to do a little bit of nutrition. And so focusing on that, but then other behaviors like sleeping, stress reduction, all of that stuff, which they really are able to do. Now, if anyone doesn't have just regular nutrition needs, that's when they need an RD to come in for sure. And they are very quick to say, help me, I need an RD, like set me up with someone different because they understand what they can and cannot do. And I actually really haven't felt too much of that trying to pull what we do away. It's more of a supportive and like, I know when to refer out to an RD. And so it's really actually been, and I'm in a gigantic corporation now, it's been a really great experience where I haven't felt that creep into the RD space at all.
Well, and like you said, I think there's a place for everybody in that sense, and there's a lot of overlap in health and wellness, and even in the medicine field, and just kind of going over that. But like I said, and we've talked about this on in previous episodes, Emily and I, about like what the difference is between a nutritionist and a dietitian. Not to like you know we're not shaming any of the other professions. It's more so just like there's an education difference. There's like a background difference. There's differences there. And like you said, to know the difference in referring to one or the other is key there. But
Absolutely.
I kind of wanted to circle back just a smidge to what you said too about how like you get all this training as a dietitian, and so many people think we like as dietitians just learn about like, oh, you have to get this much protein, this much like fiber, whatever. But we take management classes, and that has that leadership tied in. We take counseling classes which have like a psych background in it. There's a lot of math involved. Like there's just so much other components to nutrition that I think people don't realize, and those skills can be transferred to other professions, especially, and not in positions specifically for dietitians. So just because it doesn't say,
Yes.
registered dietitian required, doesn't mean you still can't apply for those positions. Chances are you have the skills for them. Like I'm sure, as director of operations, they probably weren't necessarily thinking, oh, a dietitian needs to be in this role, but it just happened to work out that you are a dietitian, which is amazing.
Yeah, no, I stepped into a role and the person before me had zero background in nutrition. I mean, they were interested in health because they're in a health related business, but had nothing to do with that. And so now I have the dual role where I have this business background, and but I still do things as a subject matter expert at SME. Like I'm still writing blogs for them, or I'm reviewing information, or they have me come in when they're planning a challenge for their members and they want to have a nutrition component. Like everyone knows to come to me or my team for that information. But yeah, I don't necessarily need that, but it's an added benefit to the company and the members, to everyone. So yeah, that's the whole thing. I did actually just join the academy again this year. I hadn't been a member for a while because I was kind of turned off by it a little bit. And I was obviously super involved. I was the president and I loved it. Like there were so many great things about it, but I kind of I felt a little bit like as my direction and the career I went towards, I kind of lost touch with it because it wasn't providing the value for the direction I wanted to go. And there is a lot of value in it. There's a lot of great things happening, but there's been a lot of boats missed for sure in helping RDs advocate for themselves and choosing what career paths. And obviously financially, I could not afford my lifestyle with an RD job right now. Like corporations offer a lot of opportunities financially for RDs to do much better, even than what universities can provide. So there's a lot out there that for sure, us RDs who are type A organized people, we have such a good skill set that can apply to anything, like really.
Yes, we do. We are type A, most of us at least. Vicky, go ahead.
Oh no, I was just gonna say, I mean, I don't consider myself type A, I'm gonna be honest. I'm not like super type A. I'm always
Yeah.
like, oh, I'm relaxed. But I do think, like I said, there's those amazing like qualities that we all have. And like I said, even just in general, personal experiences, those can also,
Yes.
make a huge difference. But, you know, I guess we should probably lead into our topic though of the day. I mean, I think we could talk to you about all this, for another hour, but we
Probably.
did ask you to cover perimenopause today. And I think that just leads into we could probably have you on again. We say this about like all our guests, like we could just talk for hours. But yeah, so I guess just tell our listeners, I mean, we kind of know what it is, but tell them what perimenopause is, what's going on in, the female body and like what kind of happens during that period.
Yeah. So it's a time period. People talk about menopause as like the entire time period, but really menopause is three different times where it's perimenopause. Menopause is really just one date in time, and then there's a postmenopause period. And so perimenopause is the entire time period where your hormones are starting to change. You start to see these shifts in the regularity to your menstrual cycles that lead to eventually the final one. And perimenopause typically lasts about 8 to 10 years. Really varies when people start going through perimenopause. On average, people are about 51 when menopause happens. So it's typically like early to late 40s. But I've certainly have had some friends at late 30s. They've really started experiencing some symptoms. It really varies a lot. So again, with your menstrual cycle, that's where people start to really notice. They'll start feeling some symptoms, not really knowing what's going on. But in general, you'll see some irregular menstrual cycles. And, it would be easy to understand if this just happened and I've got regular menstrual cycles and they slow down and it's this linear fashion, but hormones don't work that way. It really might be that for a few months, your hormone levels, your estrogen is fine, your periods are regular, and then maybe you'll be late, and then maybe you'll be early. And it's this up and down, very confusing time period where it's not a linear fashion where all of a sudden your ovaries are producing less estrogen and progesterone on a linear slope. And so it's a time period that really is confusing because you're like, oh, I feel great this month. I don't feel great that month. And it's all these fluctuations are happening. Um, Finally, during perimenopause, so there's fewer and fewer eggs that are being produced, and you have these unpredictable hormone levels, sometimes regular, some irregular menstrual cycles. And then menopause is officially once you've gone 12 consecutive months without a menstrual cycle, that's when menopause officially occurs. Again, most of the time around age 51. At this time, your ovaries are no longer producing sex hormones, predominantly estrogen and progesterone anymore. So there's no more eggs being produced, and you now have predictably low hormone levels. And so after that point, those fluctuations are done. This is a marker of like the end of a woman's childbearing ages. Um, for some people, like there are circumstances, like if there's surgical removal of the ovaries, if there's ovarian damage from cancer treatment or other medical circumstances, people can go into menopause earlier from those types of causes too. And so postmenopause, this is the time period that's the rest of your life, like after you're done with your menstrual cycles. Most of the day-to-day symptoms, and we'll talk about some of the symptoms that are most common during perimenopause, are mostly done. They kind of fade away over time because now your hormone levels are just always low. So even though they're lower than they were before menopause, it's more consistent. And so you don't have this fluctuating where I feel great one day, I don't feel great the next day. Um, Other things that happen during this time. So again, we'll talk about symptoms in a little bit. We do see really big shifts in health risks that occur after menopause, and that's caused by the shift in hormones. It's caused by some other changes that are happening with women's bodies. But you see increased risks for things like osteoporosis, heart disease, weight gain increases at this time. And those are really impactful in a woman's life during that time period.
Yeah, I think, and this is why we wanted to touch on. So, women's health is kind of our focus this season. And, you know, perimenopause, menopause, postmenopause are just things that, like, we kind of ignored. Like, oh, well, you might be in menopause. And that was it. That was all that was talk about. Oh, yeah, well, you're going to have, night sweats maybe. And I think we just need to continue to talk to get, whether it's other providers, whether it's just women in general, understanding that perimenopause is a long time, like 8 to 10 years. That is a long time of not knowing what the heck your body's going to be doing, how you're going to react to situations, how much you're going to be sweating. Like, there's just so much fluctuation, and I understand, because I have clients and they want answers and they want to know what's going to happen. You can guide them to that, it seems, but you don't know what's going to happen when. So 8 to 10 years of just being, like, questionable, I think is a really long time.
It's a very long time. And I love, I think social media is both good and bad, but the great thing is that there are obviously just more conversations about everything in the world. And menopause is like a hot topic right now. And I love that because, yeah, 10 years, that's a huge chunk of your life. And these are things that, like, my mom, I didn't even know when she was going through menopause. I've talked to her now because now I'm an adult, but, like, she, like, hit it, like, I didn't know. I know every once in a while she'd get really hot and she was sweating. So I'm like, I assumed it was menopause, but it was like, hush, hush, we don't talk about these things because women were embarrassed. Like, they didn't want, a lot of things that are happening are not fun to talk about. Like, you're not feeling your best through a lot of these different symptoms that they're experiencing. So it is amazing that there are more conversations now and people are more aware of things they can do to help them feel better too.
Yeah, so can we talk about then maybe some of the signs and symptoms of this perimenopause, and what, I might have mentioned a couple early on, but what happens, and maybe duration of them, or is it something that should be even more of an alarming kind of sign and symptom that they should really go to their doctor, or talk about some other uh, resolutions, treatment options, things like that during perimenopause?
Absolutely. So there's, I mean, I'm sure there's 100 different symptoms that people do experience. There's 40 though that are considered to be the most common. That's how many different things that can be happening. And again, now the information out there is so great that you've heard these things, but for a while you really only thought about hot flashes or maybe not sleeping that well. But there are, and again, these are driven by the hormone changes that are happening, and they have impacts across your entire body. There are estrogen receptors in almost every area of our body, every organ. Like, it impacts everything, including our brain. And so one thing we do see a lot during perimenopause is psychological symptoms. So you see huge increases in depression, anxiety, irritability, mood swings, panic attacks even happening. And again, that's driven by changes in hormone levels. You see sleep disturbances, both falling asleep and staying asleep, that affect the amount of the quality and the quantity of sleep people are getting. Even things like musculoskeletal problems, so your joint pain, muscle pain, that can be caused by perimenopause symptoms and changing hormones. We see issues with bone and muscle loss. The vasomotor symptoms, which are again your circulation, your circulatory system, that's what we hear a lot about. And so hot flashes or night sweats, that's caused by changes in hormone levels. There's also a lot of gastrointestinal problems like reflux, constipation, diarrhea, bloating, and water retention. You see huge amounts of weight change. A lot of women, on average, they gain about 8 to 20 pounds during the perimenopause transition. And a lot of it's more centrally located. So you see an increase with cortisol levels that cause body fat to be more centrally located. We know that causes more issues with chronic condition. Lots of sexual dysfunction too. So things like vaginal changes, pelvic floor weakness, decreased libido. And then other things that you might not think of at all, like itchy skin and eyes, taste changes, brittle nails. And so a lot of things that we didn't know were associated with that, and even you go to doctors and talk about those things and they might not even know to piece those together. Like, oh, these are all symptoms of perimenopause and different things that are happening. And what again makes it even more confusing is they do tend to come and go. And so it really depends on like where you're at in the cycle of what hormones, which high. And it's also the comparison between estrogen and progesterone, which one's higher than the other one at that time. And so it can come and go. It can be irregular. It can be inconsistent. You might have it for a few months and then not have it. And it's pretty unpredictable in general. So it can be pretty confusing until you sit down, look at your age, kind of think about, your menstrual cycle, paste all the things together and talk to a provider who's really invested in having those conversations with you where you're finding like, oh, this is the thing that I'm experiencing right now.
I think that's, I just didn't realize there were that many associated to it now. Like, I think that's like incredible to see that, and like the fluctuations and all of, if they're coming and going, just like your periods can be coming and going, and all of that is just very interesting because again, I don't think it's talked about enough. But in terms of, treatment, I mean, I think a lot of times people are like looking for treatment of symptoms, but there's also even things to consider for nutrition related like considerations in terms of treatment as well. And I know from your perspective, like you have helped so many women kind of get on the treatment track of like exercise and also nutrition. So do you want to talk about that a little bit?
Yeah. I just want to start the treatment conversation just with mentioning, right? I would never tell anyone they have to be on hormone therapy or hormone. It's really hormone replacement therapy is what most people call, but most medical providers say hormone therapy. But I will say that the majority of the research, if there's not a counterindication with like cardiovascular disease, hormone therapy is life changing for so many people. And a lot of the people that I have worked with, once they finally find a provider who will really work on getting them, if it's estrogen they need, if it's testosterone that they need, life changing. A lot of the symptoms almost go away. And so if you are really impacted by hot flashes, night sweats, if you're having a lot of mood changes, that can really be a huge game changer. And that's probably going to have the biggest impact, honestly. There is a lot you can do. There's a lot of things you can change. You can't change your hormone levels without finding an exogenous source of a hormone, right? You can't produce more because you want to. Like that's going to change no matter what. And then there are things for treating some of the symptoms. Like if you're struggling with depression or anything, of course, there are all the things you can do. You can do therapy, you can do medications. I don't want people to write off anything and saying, well, I don't want help. If you're struggling, like women should ask for help. Like go to your provider, say, I'm having these symptoms, discuss all the options with them because for most people, hormone therapy is a really great option and it can be life changing. It can make you feel much happier during this transition. And there's so many more options than there were before. There's gels, there's patches, there's pellets, there's creams. Like there's so many things that you can try. So I do want to start with that. I don't prescribe that. I do know that as soon as I feel like I'm going through perimenopause, I will be talking to my doctor for sure about getting on any hormones I can possibly get my hands on because how much better it has made so many people feel. So I do want to say that. But yeah, there's a lot of reasons that people wouldn't want to do that, or there are absolutely counterindications depending on different, there's different health reasons you would not be able to be on hormone replacement therapy too. And so I do have some things I really ask people to focus on. I call them like my power plan for menopause. And so there's kind of 7 different items that if you can, there's so much information out there, right? There's so many things you can do. You can't do it all, and no one has to be perfect to really make a difference. And so the 7 things that are like nutrition and lifestyle behaviors I really want people to think about are first that energy balance still matters, right? There are a lot of the things that people with the increased risk for chronic disease, right? This does happen with reduction in estrogen levels, right? You're going to have a higher risk of bone loss. You're going to have a higher risk for cardiovascular disease, a higher risk for metabolic syndrome because estrogen is protective against those things. And so another thing that you can do is if you can just reduce the amount of fat mass gain, right? I don't care if you're putting on more muscle. It's not a scale thing. It's how much fat mass you have does also impact your chronic disease risk. And so just making sure you're eating an appropriate amount to get all the nutrients you need, but not eat too much or too little. So energy balance matters, right? That is still something you want to think about through this perimenopause transition. Focusing on protein. So protein power. Protein is a nutrient that is getting a lot of attention right now. Some of it's maybe overdoing it a little bit, but in general, maintaining muscle mass is so incredibly important for longevity. And there is so much good research. I love Dr. Gabrielle Lyon. If you guys don't follow her, she is a fabulous researcher. She is an MD, and she has done tons of research on just the importance of muscle, specifically in women. And she has very high protein recommendations, really wants a protein focused goal. It's so important. So women just drop muscle mass after menopause because you don't have the estrogen. Estrogen is important for building muscle. Every time you eat at least 30 grams of protein, you are encouraging your body to build as much, you're maxing out, right? The amount of muscle you can build at that time. It is so important. And so having adequate protein, very, very important. Next is fiber. And so there are a lot of GI complications are very common for women. Like they'll have a lot of GI distress. And so having adequate fiber, at least 25 grams per day, even closer to 30 to 40 grams per day from real food is so helpful. Focusing on bone building nutrients, so calcium and vitamin D, because you do increase your risk for osteoporosis, right? Bones, they're always breaking down and rebuilding, right? Your bones are constantly turning over. And most people meet their max bone density around age 40. Of course, it varies, but on average. And so after that, you do see a decline in bone mineral density, and that decline accelerates during menopause, right? Once you're no longer producing that estrogen. So you see even more levels of bone decrease. And so making sure you're having plenty of calcium and vitamin D. Water is really important too. So hydration is always important, but we do see that if you really focus on consuming adequate amounts of water, that can help improve some of the vasomotor symptoms. So hot flashes, night sweats, being adequate hydrated can help a little bit there. Focusing on sleep and stress reduction. Sleep increase, stress reduction. You don't want to decrease sleep. Please don't do that. So rewind there. Plenty of sleep, reducing sweat, focusing on both of those. So, so important. And then, of course, focusing on strength and movement overall. Lifting heavy weights is so important, right? It's going to help you build muscle. And then moving to make sure you're counteracting any of those cardiovascular needs as well. And so I know those were a lot. We can talk more about any of those, but those 7 things are, if I could get people just to focus on those and figure out a way to get them a part of their daily and weekly routines, you're really going to feel much, much better, and it'll help ease that transition quite a bit.
I love those. So your power plan for menopause, 7 things, we just listed them. I want to go back to the GI issues and the fiber. So you touched on the food first, or real food. So can you elaborate a little bit more on that?
Yeah, I mean, really focusing on both getting soluble and insoluble fiber. And so going from sources that are fruits, vegetables, whole grains, oatmeal, nuts, seeds. I mean, all of those, you're going to have benefits of, for one, for weight management, right? Satiety, right? Fiber, higher fiber intake definitely helps you feel more satisfied. And there's also the benefits of regulating your GI tract, right? Making sure you're going to the bathroom, adequate amounts too. And so the reason I prefer you getting it from food, because the types of food you're going to get fiber from, you're also sneaking in all those vitamins and minerals you need too, right? It's a really great way that I love telling people what things to add to their diet versus taking away from their diet. You add more fiber, you're going to be adding more nutrients too, right? That's a really good thing to focus on. And just having some fruits and vegetables at every meal, whole grains at every meal could really get you a lot of the way there. Now, I'm not against supplementing if you really can't get it. And there really are quite a few products out there right now that have high fiber in them. Like I buy a lot of the high fiber breads, especially for my kids. Like they will have fruits and vegetables, but it's still not quite enough. I think there's some really great tools to help, but if you can get most of it from real food, really beneficial to go with that route.
And then too, like calcium, vitamin D, do we, you see a lot of, and I know in my realm of work, we prescribe calcium, vitamin D supplements for these women especially. Is that like, should we go to those first, or should we really try and look at their diet? If there are ways to add it in, definitely add it. But
Yeah.
do you feel like always having that calcium, vitamin D, or at least like majority of the time, is not, the worst thing in the world for them?
Yeah, it's hard to say. I mean, the dietitian in me says I would love you to get from food. I think it's pretty hard for just people that live in our area, right? Depending on if you live in an area, you get a lot more sunshine on a daily basis throughout the whole year. Like you probably get enough vitamin D from the sun. We can't. We really can't in this area. Um, and so it's one of those things that it's probably you don't want to just supplement for no reason, right? Definitely talk to your doctor. You want to get levels checked. But vitamin D in particular, I mean, it's coming from like fish. It's supplemented in things like dairy products. You can get close, but it's pretty, I think most people struggle to get enough. Same thing with calcium. You want to be careful with calcium because too much, right? If you're supplementing too much, that can cause problems too. And so you don't want to just do it on your own. There's no reason to get one of those super high dose things. Like some of the calcium like gummies, they're so good. I feel like people could overdo it just eating them, and not paying attention. And so I don't like saying supplements, but there is definitely a place for it. And I think a lot of people probably want to consider supplements for those, especially during this time period where their body is kind of working against maintaining their bone mass when your estrogen levels are so much lower.
I guess my follow-up question for you is, in terms of, let's say someone was on hormone replacement therapy and they wanted to make sure that maybe the hormones were being utilized more efficiently. Is there a way that nutrition kind of coincides with that? Um, is there foods that are necessarily help estrogen production or help it function at its best or something like
I
that?
would say the one that you're probably referring to is soy, which a lot of people think about soy because soy has phytoestrogens in it. There, this area I don't include that in my 7 nutrients. And I thought about it for a while. I did a lot of reading about soy, and it's one of those things where there may be a little bit of an impact, right? There might be if you're consuming adequate amounts of soy, which is not very typical of the American diet. So maybe in some Asian countries where you have a lot more soy-based things on a regular basis, there likely is an impact on hormone levels from that. It's so unusual, and it requires such a shift in the way an average person eats to get adequate amounts of soy on a daily basis to actually have the estrogen effect. I don't feel like that's something I would say across the board. Now, if you're working with someone who is vegan or vegetarian and maybe they're having large amounts of tofu and soybeans, they're getting a lot of their protein through soy-based options, that could actually have an impact for them. I am not an expert on that because it's not the group that I typically work with. And so I couldn't even tell you the exact amount. I know there's max amount you want to aim per day and minimal amounts to get an impact. That's just not an area I've dove into too much because it's not the people that I typically work with. Otherwise, I mean, just eating a general healthy diet, like having a healthy metabolism, having a healthy life so your body is functioning normally, keeping your blood glucose levels regular, keeping your insulin levels regular, like following all this protocol, like those 7 things, and just having it and being active, like all of those things make everything in your body function the way it's supposed to. Sleeping well, like sleep has such an impact on hormone levels and how hungry you are, your ability to build muscle. All of that is so important that following a healthy general diet and plan does impact. It all impacts each other. There's fascinating research about sleep, even sleeping less than 7 hours per night, on how that impacts your hormone levels. You literally feel hungry because you have you have more ghrelin, right? Ghrelin makes you hungry. I think of ghrelin as like the gremlin hormone that's like, give me more food, give me more food. And it's literally higher. Your leptin is lower after not sleeping adequate amounts. And so sleep does have an impact. And then what does that do? If you're trying to follow a plan and you're feeling so hungry all the time, it's really hard to do that. It's hard to eat the right food. So sleep is hugely important as well.
I think for women too, just not even, nutrition focused here, but whether it's society, whether it's the lifestyles we live, it's almost like it's working against us because now you have, unfortunately, in our life where moms are working full time. That it's not just a father or father figure working, the mother stays at home. Mothers are working. So they have not just the stress of going to work now with their kids, they've got it all. And so trying to find that balance then I think is really hard. And I almost think that like perimenopause time frame we were talking before we even hit play of like you're running around go go go. So like how is a mom, potentially an aunt, a caregiver, someone, how are you supposed to balance all this and make time for yourself? It's a lot.
It's so much. And that's whenever I talk about nutrition during perimenopause people, there are definitely certain things that you do need to think about a little bit more, but most of it's like general healthy advice you give anyone at any life stage. But there are a lot of changes that are also happening when you're in your 40s, right? A lot of times you do have kids. It's like, it's also, if you're working, it's kind of like the peak of your career. You probably have more responsibilities than you ever had. Like you've kind of made your way to a spot where you're doing more. You're not just, you're making decisions. It's more stressful. And then maybe you're also taking care of parents at that point because now they're a little bit older and they need more support. And so you're kind of that sandwich generation where you're helping kids, you're helping your parents. Like there's a lot going on there. I will say my own personal experience, and I'm not perimenopausal yet. I thought I was, so maybe I am. I don't know. Every once in a while, I'm like, maybe I am, maybe I'm not. I don't think I actually am. But I have been struggling more with I can't get to the gym as much because I have the responsibilities for my kids. And so I'm having to adjust. And when I do go, I go for 30 minutes, not an hour and a half anymore. I don't walk as much because I'm just sedentary with my job and I was more active. And so some of the shifts that people see in particular their body composition and their weight, they're like, I don't understand why I'm gaining weight. I'm doing everything the same. Are you? Sometimes you have to ask that question because maybe you think you are, maybe your food's kind of the same, but how much has your lifestyle changed? Are you a lot more sedentary? And that can slowly happen over time. And people don't realize how much their lifestyle really has shifted. That's made it more challenging to maintain the weight that they were at. And these things happen slowly over time. And then you're at a totally different kind of lifestyle by then. So, yes, it's hard. I'm a big fan of when I think about creating a plan. First off, making your home food environment work for you. So that's one thing you can control. And so of you don't have to be perfect, right? I give you a list of a few things that's even more basic than you might get somewhere else. And it can get really overwhelming. You're like, I have to do all these things perfect all the time. But one thing you can do, you can control what foods are in your house. And not that there needs to be nothing there that can, is considered maybe not a perfect food. You can have those things there, but make most of what's available for yourself, things that are supportive of your plan. And not just having them in your house, but have fruits and vegetables that are washed and cut and very easy to grab because when you're about to run out to your kid's soccer practice, it's very easy to grab that granola bar or those chips that are in the single serve bag if you don't have fruits and vegetables cut and ready to go. And so making changes to what you have available at home, I think can be really, really helpful. And then I'm a huge planner. And so just having as much planned ahead, it doesn't have to be every exact meal, it doesn't have to be everything you're doing, but generally knowing, and I personally do like to plan out my dinners for the week. I think that's such a good anchor to have done. I'm going to have this on Monday, this on Tuesday, because I'm too busy to worry about on Monday. What am I cooking tonight? What do I have available? Do a grocery shopping for just your dinners and have everything available in your house and know where you're cooking which day. That can make the rest of your day kind of fall in place too. It reduces the stress, it reduces the running around, it reduces grabbing the food on the fast food drive, which you can do every once in a while. That's fine. But most of the time, having a little bit of a plan and having your home food environment really supportive of healthy eating can be a huge change in your overall habits.
Those are really good points to make. And I think planning is like the biggest thing with any client I see is like they're on the go, they're not realizing that their lifestyle has changed a little bit and they say, "Oh, well, I got to stop at, the gas station, I got to stop at the fast food and this and that." If you plan just some simple, even if it's snacks, I think that's even a start for some people because they're on the go, but they're not fueling enough too. So I think that's a really great way of advice. And do you have any other kind of we hear a lot about the Mediterranean diet and other lifestyle factors that are important. Do you have any other like specific recommendations besides that nice balanced diet of what has come out? We talked about soy a little bit, but anything else like specific that has come out for our perimenopausal women?
Yeah, I mean, it's not. I mean, no, for most people, honestly. So focusing on fiber and protein is to me the most important things because everything else, if you build your diet around protein and fiber, the types of meals you're going to create from that are going to be supportive of the other things you need as well. And so really those are the key. I always say that the most important behavior change I've ever made in my life is taking my cell phone out of my bedroom at night. I don't keep it there. I keep it on the charger in a different room, and my kids don't drive yet, so I know that might change when they're out and about, and I need to be able to be on call. But because sleep is so important. And that's something that if you find yourself on your phone right before bedtime, or you find yourself waking up, and if you're waking up with night sweats and you can't fall back asleep, you get on your phone, you end up being up so much later. And so creating a sleep ritual also, that's another thing. I would say that yes, nutrition, like thinking about your fiber, your protein, calcium and vitamin D, but really figuring out a way to sleep in a comfortable environment without distractions. I think that's the best thing I've ever done for my health, to be honest.
Well, and I think too, you bring up a good point, which kind of leads into the next point of conversation. And sleep has a lot to do with that, is stress management and how we deal with stress. And, you know, those stress hormones can definitely play a part in not sleeping well, not being able to, function at our best. Not, so what would you suggest to people who are maybe trying to reduce their stress, and how does that play into the perimenopause um like process, I guess?
Yeah, I mean, it has a huge impact on everything. I do think planning ahead helps reduce stress. Right. So that is one thing that you were thinking about from a nutrition standpoint, like having a plan in place that is flexible but helpful. Um, whether it's, your dinners, whether it's your snacks, whether it's just the night before thinking about, okay, what am I going to eat tomorrow? Like, you don't have to write it down even just in your head. Like, what am I doing? Just having somewhat of a plan can help reduce stress. Exercise is the key to stress reduction. Now I know it's so hard for some people. Like, they're like, I can't get to the gym. Like, at least go for a walk. Walking with a weighted vest. We could talk about that if you want to. Is a big thing right now. You see every premenopausal woman is walking around with a weighted vest right now. That's like the thing, and it's great. Like, getting a walk helps to reduce stress, and you're getting exercise or getting movement in too. Especially if you can get outside and do that. The impact of being out in the sunshine, being in fresh air, is such a large stress reducer. Highly recommend that. Even just 10 minutes here or there. There's lots of research that suggests that 10-minute blocks of exercise can really make a big difference um, in stress reduction in particular. Not maybe not cardiovascular health as much, where you want to get your heart rate up a little bit more than that, but walking for 10 minutes can definitely help with stress reduction.
Well, since you alluded to it, why don't you talk a little more about the weighted vest? Go for it, because yeah, I've seen it too.
Yeah, it's such a mixed area. I mean, there's definitely some claims out there that are far beyond really what it's doing. I mean, it's not the end all be all going to solve all your exercise problems. It's not the same as running and getting your heart rate up. But for sure, like anything you're doing, right? With exercise, you want to do progressive overload, right? You want to work your muscles a little bit harder than they're working the next day. That's how they respond, and they get stronger in response to that. And so, especially when you first start walking the weighted vest, that's more weight in your body. And so your bones are going to have to respond to that. They're going to get stronger. Your muscles are going to get stronger because you're walking with it. Um, What's questionable is that over time, then, do you keep adding more weight? Like, at what point do you have like 200 pounds you're trying to walk around? You're not going to walk very far with that amount, So it's not replacing resistance training. It's not the same thing. It's not going to be the same benefits. But for sure, it's having your body work a little bit harder with the vest when you're walking. There's going to be a little bit more calorie burn. There's going to be a little bit more work on your muscles. So, not replacing, because you see crazy claims. Some claims about it replacing, you have to lift weights anymore at the gym. Yes, you do. Like, those are different muscles. You need to go with heavier weights in the gym still, but it's definitely one tool that can be helpful. It gives you a little bit more working for those muscles and those bones during a walk. So I don't mind it. I would say two nutrition areas I didn't talk about because they're not on my list of things to include would be alcohol and caffeine. People ask about that all the time. I mean, alcohol in particular, alcohol is rough on your body. I mean, there's really no benefit to including alcohol in your life from a health standpoint. There's nothing, there's been a lot of back and forth. I think I did my thesis. Actually, I'm thinking about that right now. When I was at Penn State, my undergrad, on alcohol and health effects. And I was trying to, like, of course, I'm at Penn State, I'm like drinking all the time. I'm like, yeah, alcohol is beneficial. And so specifically red wine. And of course, there may be some, antioxidants in red wine, but you can get those from grapes too. Like, you don't need to drink the alcohol. Most of the research now has found that there's really no benefit of the alcohol piece. There's been some conversation about that. And your body just processes alcohol differently the older you get. It stays in your system longer. And the impact of even one drink on your sleep is strong. You really have less deep REM sleep. And if you're already struggling with sleep, if you're already struggling with night sweats, having alcohol, one glass can really have an impact. Now, I still have a glass of wine here or there. I'm not saying I never drink those things, but for sure, there's a lot of people that really, really impacts their sleep overall. And so may want to consider reducing alcohol or removing alcohol from your life. There's only benefits from that if you're finding that it's really not helpful for you. That's a huge thing for people. So I don't have it as my things to include because I don't want you to include alcohol, right? That's something that definitely a personal preference, but I do talk friends my age, but also clients. Removing alcohol can be a huge thing that really helps them feel a lot better.
I know I've reduced my alcohol intake significantly over the past few years. I mean, I rarely drink anymore too.
Yeah.
And like if I have a glass of red wine, because our family makes it, so I'm going to enjoy a glass of red
Yeah.
wine here and there. But if I have a glass, my sleep, I'm like,
Yeah.
that was horrible. I don't know why I did that.
Never
it
get
is.
into
It
REM
really,
sleep. You don't get in the deep sleep. You just kind of stay
yeah,
awake. And so every little thing can wake you up. And so that's really, it's
yeah.
unfortunate. I wish it wasn't, wish it wasn't true. And it's worth it every once in a while to have, but it does have a big impact. And then caffeine, I mentioned too, like I love coffee. I'm a coffee drinker. I will never say don't drink caffeine. Caffeine, everyone metabolizes caffeine different. There is such a variety in what the impact is. You definitely want to aim for less than 400 milligrams per day, which is not hard to stay under if you're drinking coffee. But there's so many new drinks that come out all the time. I was talking to a girlfriend who her daughter likes, I think it's Alani Nu. I think it's Alani Nu one of the new drinks, one of the new
Yeah.
cans that are out there right now. And a small can has 150 milligrams of caffeine. It might even be 180. It was 2 or 3 cups of coffee in this one can that is only 12 ounces of fluid and it tastes like juice. And her daughter was drinking one per day. I'm like, I'm just so you know, I mean, she's 11. I'm like, just so you know, like this has that much caffeine. And she was shocked. She didn't know. So just be careful with caffeine because it's in so many beverages now. They sneak it in even like seltzers that just look like normal seltzers, like with caffeine and everything has caffeine in it. So the reason I say that is because sleep is already a challenge, right? During perimenopause, people have trouble sleeping, falling asleep. If you are someone who drinks caffeine, caffeine's half-life is typically 8 to 10 hours for most people. That means it'll be half out of your system within 8 to 10 hours. And so if you can stop drinking caffeine by noon, that means most of it will be out of your system by the time that most people go to sleep. So 8 to 10 p.m. it'll be mostly out of your system, right? It'll be on its way of being metabolized. You'll always know people that will say, I can drink caffeine and go to bed. Okay, that's fine. But if they start to see an issue with sleep, you definitely want to consider it. Try to stay under 400 milligrams. That's the max really per day. And staying before noon can be really helpful.
I think that is very interesting about the caffeine component. And I do like you are so right about like where caffeine is hidden in and like just all these different things. Like I was at the grocery store the other day and I was looking at these like different like flavored waters and they have like a probiotic water but then they had like an energy water right next to it and like the flavors were different. So even if you were just like looking at the water and you're like, oh, that flavor tastes good, like, and you're not paying attention, like it could just so much be easy to just grab that and think like, oh, it's just water, whatever. And it's just very interesting of how the marketing is in terms of caffeine and where it's just hidden everywhere. It's wild.
Oh, yeah.
And then, like you said, they make it so easy for younger kids. I mean, 11 years old to have caffeine is tough. Like that's going to affect you for a long time. Because I mean, I know I didn't start drinking a lot of caffeine until I was in high school, I think, and like the significance is just now I'm addicted to coffee all the time. But like it's just so funny how that
And even
all
a
works
cup of
out.
coffee, 80, 90 milligrams, you drink it slowly over time. Like these drinks, you drink them
Mhm.
fast, right? They're gone in a few seconds.
Mhm.
Yeah. And they
100%.
taste so good. Like they're delicious. I enjoy them too, but it's a lot.
Yeah. So I guess I just there's so many like myths about menopause and perimenopause out there. Um so we could do a little bit of myth versus fact in perimenopause language if you'd like to do that.
Sure.
Um if that's cool. So the first thing is I'll say the myth and you debunk it for us, okay?
Okay.
Perimenopause and menopause are the same thing.
Yeah, as I mentioned before, like, it's so common that people say that, and it's like you're not really wrong, but the specific menopause is 12 months after your last menstrual period. That is the date that is marked down. Everything after that, you're then postmenopausal. So perimenopause is that entire time period, 8 to 10 years, where you're transitioning, your hormone levels are changing until you hit the actual menopause transition at that date.
Okay. And perimenopause only causes hot flashes.
Definitely not, right? We talked about I don't know if I listed all 40, but there are 40 common symptoms, but there are hundreds that people do end up showing up with. So they vary much more than that. Again, things like joint pain, which is something you don't think about. A lot of mental health concerns that really increase during that time period. The changes you don't really feel, eventually you see, right? The muscle loss, the bone loss over time, like all of those are symptoms beyond just the hot flashes. So those vasomotor, maybe you feel them as most, they're the most uncomfortable. You recognize them and we know them. We think of them as the menopause symptoms, but there's so many more than that.
Okay, this one we didn't really cover much. So you can't get pregnant during perimenopause.
You definitely can. And you always, there's always circumstances where like, I thought I was done. Because again, you might go 3 or 4 months. I've talked to so many women who have been so close to the 12 months. They've been like 10 months down, 11 months since their last menstrual period, and they get one. And so when you're getting a period, that means you're ovulating, right? You have an egg. And so you can absolutely fertilize that egg and you can get pregnant until you are 12 months out and officially done. I would get hormone level testing too, like make sure your estrogen really is low. You absolutely still can get pregnant while you're still producing eggs.
Okay, the next one is weight gain is inevitable.
It feels that way sometimes. Again, and we didn't talk about weight gain too much, but there are a lot of things that make it more challenging. There's a huge myth that you may bring up, you may not, but that women's, your metabolic rate is so much lower during menopause, where you're burning 500 less calories per day because estrogen is lower. That's not true. Like that's been debunked. There was some research that was published, I think 15, 20 years ago now, that showed that. But that research, that data was reassessed, and that's not really what's happening. Really what's happening is that your lifestyle is changing primarily. Like you're just not moving as much, and that's just what happens with age. Now, what does happen is there is a small shift in how much you're burning because most women are losing muscle mass. And as you lose muscle mass, you are going to burn a little bit less, but that's in like the 50, maybe 100 calorie range per day. It's not as hugely impactful. And so it's really more how much your lifestyle has changed. Um, and that's hard because people don't recognize that's happening and they really think they can't explain what's going on. But it's like you really are just moving less. You're not as active as you used to be, is most oftentimes. So it's not inevitable. You can balance that by having a plan for exercise, get to the gym, lift weights, move your body, and pay attention to what you're eating. And if you're hitting protein goals and hitting fiber goals, you're going to be so full that you're not going to overeat your food, where you're going to be eating an appropriate amount most of the time. Again, if you're getting that stuff from whole foods, that you can manage your weight through perimenopause. You do not have to gain weight at all. Most women do, but you don't have to. That's not inevitable.
Okay, and then this was Emily's favorite, so we'll end on this one. If you are in perimenopause, that means you're old.
I mean, it kind of does, but
No,
old's not a bad thing. I like being this old. Every year keeps getting better and better. So again, there are some people too who go through menopause for surgical reasons or, other medical reasons that are not at all old. And many of us are old that are starting to get to that time period. But 30s or 40s, that's nothing. That's not even halfway through life at that point. So you're not really that old at all.
Right. Exactly.
Great debunking.
Yeah.
Awesome. Well, I think any last words of wisdom, anything we didn't share or talk about perimenopause or menopause that you want to talk about, Jess, or just final words of wisdom?
Yeah. My final words are just do the things that are what healthy living is. Focus there. It doesn't have to be detailed. Don't worry about the tiny thing you're reading here and the supplement there and the specific have to eat this way. Like if you just focus on the core elements of what is a healthy diet, if you focus on reducing stress, getting sleep, moving your body, you're going to be 80, 90% there to having a healthy lifestyle and feeling your best through menopause, because really those things are going to make you help reduce some of the symptoms. They're going to help you feel better overall through that whole transition. So don't complicate it too much. Just really become a master of the simple things, and that will have a huge impact on your life.
Well, thank you so much for all that. I think that those were great last words of wisdom. So, as we normally end our sessions, our episodes, we do our sweet and sours. So, Jess, have you thought of some sweet and sours you would like to share? And you can do whichever one first. We kind of like to end on our sweet, but you decide because we're ending anyway. So,
okay. I have a sweet in mind right now. Let me think of a sour. What am I sour on in the world of nutrition right now? I like to stay within that world. I'm a little sour on the debate about collagen right now because that keeps going back and forth. And collagen is not a complete protein. It doesn't have all the amino acids you need. And so I don't mind people taking it. I think that they are inflating the impact of saying what it does to your hair and your nails. There's not really good research in humans on that. And so when you see a lot of the collagen research out there, it's from companies who are selling collagen supplements. And so it's not my favorite protein. It's okay, but I'd much rather someone, if you're going to take a protein supplement, go with something like whey, which is a complete, has all the amino acids that you need. And you know for sure you're getting everything there. So there's been some debates recently with people I really respect. And I'm like, are you getting paid by collagen? I won't be surprised if you kind of soon see their name associated with some supplement companies. That makes me a little upset because I'm like, man, you know this research. I typically trust you, but that's one area that I don't hate collagen. It doesn't do the magical things that people claim that it does. So that's my sour.
That's a good one.
That's a good one.
And then how about your sweet?
My sweet, I'm just sweet on building muscle right now. I think that that's just a key to so many things. Going to the gym is just my mental health anyway. So I love lifting weight. I've been lifting weights 30 years of my life. I really started when I was 12 years old. I just turned 42. And that's why I'm like, I don't need, this is not going to advance my career having my certified personal trainer. I'm doing that with NASM right now, but I'm like, why not? I love building muscle. Like, why not officially have something behind my name that says I know how to help people do that? But lifting weights, eating adequate protein, like it just really makes such an impact on your life. And I see so many women that have never lifted weights and they just look frail. We're all still young enough that it wouldn't impact your daily life if you're not lifting weights. But when you get to 60, 70, like if you can't support your body, you can't lift things anymore. You can't function in the world. You're going to be more likely to get fractures. You're going to have more issues. And so I want to be running around and playing with my grandkids. I want to be a healthy part of society. And so I'm super sweet on lifting heavy weights, eating adequate protein, because building muscle to me is just the key to so many unlocks for your health overall.
Love it. All right, Mickey, why don't you go?
Okay. Let's see. What am I sour on and what am I sweet on? I didn't even think of anything, so this is gonna be interesting. I'm gonna ramble for a sec. I was gonna try and keep it nutrition related, but I think I'm gonna have to cop out a little bit. My sour is I have just not been enjoying I don't know, like the constant, this is gonna sound so stupid. The people that are like such jerks when driving. Like, I don't know what it is about people, and they're just like constantly in a rush and they're not paying attention. And I've just seen too many recent stories, especially about like hit and runs and stuff. And I don't know, I don't know where everybody's going in a rush, not paying attention. I know this has nothing to do with nutrition, and we don't always do our nutrition related, but like it's been on my mind a lot. I'm like, where are y'all going? Like, relax, calm down. And then
See, I feel like I've been behind slow people. And I'm like, come on, people. But today I was like, it's Sunday. Just go with the flow.
I just maybe it's just like not paying attention. Like, I don't know if people just like they're just in their own little worlds and like they need to be more.
Everyone's kind of angry and stressed. Everyone is angry and stressed right now in general.
Yeah. So I think that's just, it's not good. Like, we got to be a little bit more cognizant of our surroundings. Like, whether you're going fast or slow, like just pay attention. And then my sweet is I last night I had a fun day yesterday, but I got to see Legally Blonde at one of the local theaters, and that was really fun. So I was just enjoying that. So yeah, that was fun, and yeah, I'm sweet on that.
Very nice. That does sound fun. All right, so mine are not nutrition today either, but so my sour is lately I've been thinking about, so we've talked about this before, but I have hypothyroid, so I gained about 20 pounds at some point, 15, 20 pounds at some point. My wedding rings don't fit. My engagement ring fits, ironically, but my wedding ring doesn't. Same size. I don't know what the difference is, the shape, the style. But I'm just kind of sour that I can't wear my wedding ring. And so I think I'm going to have to just go buy like a cheaper version because I don't really like wearing these like fake ones. They don't do it for me. So that's what I'm sour on lately. And And then I'm sweet on, I had a different one written down, but I'm going to say, just because also Jess went to Penn State, I was actually at Penn State on Friday for the volleyball game, and it was a nail biter down to the last point pretty much. They won in 5 sets. It was like 15-11 when they won, but I was like, we got our money's worth of this game, and it wasn't expensive, but I'm like, that was a good game to go to. It was my first one. I love watching Penn State volleyball. So it was great. It was a great Friday night, but we didn't get home till 1 o'clock. So I'm a little sour on that too.
Oh, so fun.
Yeah.
A football game last night though, but it was fun to watch. It was rough ending.
Yeah. I know. So all right. Well, thanks so much again, Jess, for coming. It was so nice to chat with you. It's been a little while since we've connected, but again, we follow on socials and we see what's going on with everyone. So I am sure we will have you back as a guest again. So we are going to close out here and let our listeners know that if you're in the mood for a boost of juice, check out our freshly squeezed episodes on Sundays of the RD Squeeze. And we will see you next time, everyone. Take care.
Be sure to follow us on Spotify, YouTube, and Instagram. We will always take topics you want to hear about, so message us for any topics you want to see covered on the RD Squeeze. Don't forget, it's dietitian with a T. We'll see you next time on the RD Squeeze.